Good evening, ladies and gentlemen. Thank you for coming around to this wonderful and interesting, because I promise it's going to be interesting, seminar about fatty liver disease. A lot of us wonder, how can the liver get fat? Well, we'll find out shortly, and we'll see how important the liver is to us. I remain my humble self, Lucky, Dr. Drugs, and I have the pleasure of presenting this topic. So, without much ado, our table of contents goes thus. We have to talk about the liver. We're going to talk about fatty liver disease. And of course, because fatty liver disease is a lifestyle disease that is caused by another lifestyle disease, we'll have to talk about lifestyle diseases briefly. Then we'll talk about fatty liver disease itself, the types of fatty liver disease available, signs and symptoms, causes and risk factors. We'll talk about the relationship between high blood cholesterol and fatty liver disease, because a lot of people notice that once they go and check their lipid profile, they find out that they're having high blood cholesterol when they find out that their liver is enlarged as a result of fatty liver disease. Then we have complications, diagnosis. We'll talk about very popular terms like lipid profile, liver function test. We hear this a lot. People go for that. I'll just give us in a very simplified way what these things are about and why they're important. Then we'll talk about epidemiology. Of course, prevention of fatty liver disease is not left out, and management and treatment, amongst others. So, the liver, look at this magnificent organ. The liver is a vital organ that plays a crucial role in our overall health and is situated in the upper right side of the abdominal cavity, just below the diaphragm. We'll find out why some people have certain symptoms towards that right side, also up the right shoulder as well. Because, it's already obvious, because the liver is situated somewhere around that area anatomically. Now, its unique structure and functions enable it to perform a wide range of tasks, including detoxification, cholesterol metabolism. You see, we are going somewhere already. Hormone regulation. Can you imagine even something like hormone-related issues can emanate from problems that have to do or are related with the liver? So by understanding this, you see that the liver is very, very important. But we need to understand the functions of the liver so we know how important it is to make sure our liver doesn't have any issue, and also to make sure that if the liver is having issues, we give it high precedence over other matters. So that the functions of the liver. The liver is a vital organ with diverse functions. It has metabolic functions that have to do with carbohydrate metabolism. Metabolism just means that biological processes that take place in the body, either by building up or by breaking down. Now, protein metabolism, you can imagine that even the things that clot blood are produced by the liver. Then we have fat metabolism and cholesterol production. We all know that cholesterol is one of the most dangerous things on earth. We'll find out shortly why that is. Then we also know that it also has a lot to do with hormone regulation, detoxifies. Yes, it has detoxification functions. It detoxifies the system. That's toxic removal, waste removal. We have drug metabolism, that's drug biological breakdown or reformation, as aforementioned. Then we have alcohol metabolism. That is why you see that we have two types of the issue we're about to talk about today. Get to that shortly. And those have digestive functions. Believe it or not, the liver produces about 700 mils to 1 liter of bile every day to ensure proper absorption and, of course, digestion of fat in our system. And, of course, that means if there's a problem there, all those fat-soluble vitamins like vitamin A, vitamin D, vitamin E, and vitamin K will not have adequate access into our bodies, because what is essential to metabolize fat may have been affected as a result of fatty liver disease or other diseases. And these are more what we're going to talk about shortly. Imagine it has immune functions. It has blood functions. It filters the blood. And of course, talk about the blood clotting. Then we have red blood cell regulation. Liver is what helps to recycle dead red blood cells and actually helps to remove the iron in the blood cells, in damaged red blood cells, keeps it in one place or sends it back into the bloodstream for production of new red blood cells and converts the other parts of the hemoglobin into what we call bile. That also helps with emulsification of fat during digestion. We have other functions, of course, energy production, cholesterol regulation. Just imagine how important this is when we know that cholesterol deposits are responsible for a lot of issues, starting from increased peripheral resistance and hypertension to ischemic strokes, heart attack or myocardial infarction, angina pectoris or chest pain, and a host of all that. Peripheral artery disease, then we have even including damaging nerve cells that supply our limbs, like the legs, causing what is called neuropathy, that terrible sensation people have, slow wound healing and all that, source of cholesterol blocking blood supply to essential parts of the body. Just imagine how important the liver is, because it also has a large role to play in regards to regulation of cholesterol metabolism. Can you imagine? You see, a dysfunction or damage to the liver can lead to various health issues, including liver disease, metabolic disorders, digestive problems, immune system impairment, and so on and so forth. The structure of the liver consists of lobules, which are functional units composed of liver cells, bile ducts, which conducts or transports bile from the liver to the small intestine. We have blood vessels as well, which also ensure that there's adequate supply of blood to this organ. In fact, about 25% of the blood that leaves the heart goes through the liver. That shows you how important this is. Now, some diseases and disorders may plague the liver, leading to unwanted complications, which include what we're talking about today: fatty liver disease, hepatitis, which we're going to talk about shortly in about 2 days' time, then liver cirrhosis, liver cancer, liver failure. But interestingly, the liver is so powerful that it can regrow up to about 90% of its tissue if damaged. It's indeed a super organ. But, and amazingly, as I mentioned, it produces about 1 liter of bile a day, which is, of course, essential for fat digestion and absorption, including aforementioned vitamins, vitamin A, D, E, and K. But before we move further, I always talk about the greatest assassins, not being 007 James Bond or the man that acted Mission Impossible, Tom Cruise. No, these are not the greatest assassins on earth, amongst others. Or Samuel L. Jackson in the Bodyguard and all that. You see, the Assassin's Bodyguard, sorry. You see that the cholesterol deposits directly or indirectly accounts for most cardiovascular issues and lead to what? Ischemia. Ischemia simply means blockage of blood supply, leading to death of the cells that are being starved of blood and oxygen as a result of that blockage. Stress also affects DNA, as you can see. And remember that DNA is the MD CEO, managing director, head of board members of everything about us. In fact, we are just information that are going to be passed to our children in DNA. That is basically what we are scientifically. Now, lifestyle diseases. Because we're talking about the lifestyle disease, let's just quickly talk about what they are. These are diseases linked to one's lifestyle and are non-communicable diseases. An example of these lifestyles includes popular lifestyle that we know, like lack of physical activity, poor dieting, alcoholism, smoking, substance abuse, lack of rest, amongst others. So these are other types of lifestyle diseases, apart from what we're talking about today, which is, of course, fatty liver disease, and includes high blood cholesterol, cardiovascular issues, atherosclerosis, that is blockage of blood vessels by cholesterol aggregates. Then type 2 diabetes is also a lifestyle disease. Stroke, respiratory ailments, and others. But many of these combine to form what is called a metabolic syndrome. And this includes hypertension, type 2 diabetes, high blood cholesterol. These things work together as a team. You see that lifestyle diseases actually move together. They often move together. One can cause 3, and 3 can cause 1. And that is just how they are. It's like all for one and 1 for all. That's what they are. You understand? So that's just what it is. So we have to make sure that we break off their cycle, talking about lifestyle diseases. Now, prevention of these lifestyle diseases entail avoiding the avoidable risk factors. And lifestyle diseases are mostly reversible, thanks be to God. But guess what? The earlier, the better. Ladies and gentlemen, All right. This is fatty liver disease. Fatty liver disease is also known as hepatic steatosis, and it's what? A lifestyle disease where there's an abnormal accumulation of fat in the liver cells. So it is a condition characterized by excessive accumulation of fat in liver cells, which can lead to liver inflammation, scarring, and cirrhosis. Now, early detection, lifestyle modifications, and importantly, use of natural pharmaceuticals can help manage fatty liver disease and prevent complications. When chemicals are ingested, the liver even recognizes most of them as what? Poisons. That means the liver knows. And you can see why when people take a lot of alcohol, it can lead to what we're going to talk about shortly. So these are the two basic types of fatty liver disease. You can see the innocent looking fatty liver on the left, holding his jug of beer because he has been drinking all night. And then we have the other innocent looking fatty liver over there that has not even been taking alcohol, but has found himself in a situation similar to the guy that has been drinking alcohol. That is why we have basically two types: alcoholic fatty liver disease, which is due to excessive alcohol consumption, and non-alcoholic fatty liver disease, which is not necessarily associated with alcohol consumption. That's why you see those two gentle fatty livers over there. So let's start from alcoholic fatty liver disease. Basically, from its name, we know why liver has acquired so much fat that it has changed its baptismal name from just a simple healthy liver towards fatty liver. And you can see alcoholic fatty liver disease is a condition caused by excessive alcohol consumption leading to liver damage and scarring. And it progresses from through three stages: fatty liver, alcoholic hepatitis, that's inflammation of the liver as a result of the issue we're talking about, and then cirrhosis. Now, the symptoms include abdominal pain, fatigue, nausea, jaundice, and more. Now, it's diagnosed through blood tests, imaging studies, liver biopsy, etc., and its treatment involves alcohol abstinence, medications like the statins, the one we know, like the atorvastatin and simvastatin and others, which are used commonly, especially in high blood cholesterol cases. Then corticosteroids, and of course, natural pharmaceuticals and lifestyle changes. Very, very important. Remember that the liver is its own doctor. So once you withdraw what is causing the problem, you see that the liver begins to get better. We'll talk more about that shortly. Now, in advanced cases, one may need liver transplantation just because of fatty liver disease, believe it or not. And generally, early detection and intervention improves the outcome. Of course, the first thing to do without being told, once somebody is told that is having alcoholic fatty liver disease, you and I know that the first thing is to what? Stop taking alcohol. That is the first thing. So that's the first treatment for anyone. Now, non-alcoholic fatty liver disease is a fatty liver that is not a drunkard and ends up looking like a liver that's a drunkard. So you can see that non-alcoholic fatty liver disease has different subtypes, which include simple fatty liver disease with fibrosis, that is scarring and, of course, scarring and all that. Then we have non-alcoholic steatohepatitis, which is a subtype of what we just talked about, and characterized by inflammation, scarring, fatty accumulation, and a lot of others, and also drug-induced fatty liver disease. You can imagine that certain medication can cause this, including what? Methotrexate and amiodarone, of course, birth control pills that mimic certain types of sex hormones, corticosteroids, antidepressants, and psychotics can lead to this, and a lot of other issues that are involved or associated with such medication can lead to that. Now, non-alcoholic fatty liver disease can lead to complications like liver failure, cardiovascular disease, and increased risk of cancer. Diagnosis is similar to the other one, and it involves blood tests, imaging studies, liver biopsy, etc. Of course, management focuses on what? Lifestyle modification, which includes weight loss, healthy diet, exercise, etc., medications, early detection, and of course, use of natural pharmaceuticals ensure a best outcome. These are the signs and symptoms. Abdominal discomfort. A lot of patients that come to me and say they have fatty liver disease always complaining about abdominal discomfort. But we know why. Because the liver is located in the abdomen. And that's why. And then fatigue, tiredness. The liver is involved in energy production. Then we have loss of appetite, nausea, vomiting, abdominal swelling, ascites or pot belly, enlargement of the liver or fluid accumulation in the abdomen. You see a lot of people showing their pot belly as evidence of good living. Brothers and sisters in the Lord, it is a disease called ascites, oftentimes, or of course, excessive accumulation of subcutaneous or visceral fat. These are all very strong risk factors for lifestyle diseases. Of course, it is not good. Now, dark urine and pale stools, we know why having pale stools, because you know that the bile that is supposed to be emulsifying fat or aiding fat digestion is not even available. And you know, bile is responsible for that dark brown or brownish hue that is affiliated to our feces. Then we have weight loss. Remember, it has digestive issues that come up as a result of the bile not coming out the way it's supposed to be. Insulin resistance, that's difficulty regulating blood sugar, mental fogginess, depression, sleep disturbances, right shoulder pain. Please bear this in mind. Confusion and disorientation. And these are very, very important because people have these symptoms. They talk to me about it a lot, and I try to explain to them, go and run a liver function test, which you are going to know why it's important shortly. Now, one of the major causes of fatty liver disease is high blood cholesterol. Talking about bad cholesterol, especially that's low density lipoprotein and very low density lipoprotein. Just talked about insulin resistance in the other aspect, but of course, you can see that they both are risk factors for each other, which is type 2 diabetes. Now, when the body becomes resistant to insulin, the liver stores more glucose as what? Fat, leading to fatty liver. There's something called the rejuvenate pathway, where liver and fat is actually produced straight from carbohydrate like glucose. And then you can see obesity can also predispose one to high blood cholesterol, which in turn predisposes one towards fatty liver disease. So hence, a high body mass index is a strong risk factor for fatty liver disease. Metabolic syndrome, this is a cluster of conditions including insulin resistance or type 2 diabetes, high blood pressure and high triglycerides, which can increase fat storage in the liver. Genetics, that is when one is genetically predisposed to having such issues. And then we have high triglycerides. We'll talk about that shortly. We're talking about the liver function test, and then sedentary lifestyle, lack of exercise, unhealthy diet, alcohol consumption. We know that already. Certain medications, sleep apnea, that's obstructed sleep patterns, type 2 diabetes as a result of insulin resistance, and high blood sugar levels to fat accumulation in the liver. Cushing syndrome simply means there's an excess of cortisol or stress hormone. You can see this picture on the right here, lower right of our screen. You can see somebody's liver is already taking the shape of a fast food restaurant as well, with a chocolate topping on top. You can see these things are a no-no when we're talking about fatty liver disease. Apart from Wilson's disease and the other one, we also have gallstones because they can actually block the path through which bile flows, and this can lead to fat accumulation in the liver. Talk about that shortly. Then we have pancreatitis, that is inflammation of the pancreas. It's actually a common duct where the bile meets with the duct coming from the pancreas before it opens up into the duodenum, and that can lead to blockage of that area, and of course a backflow of bile, and finally get to cause fatty liver disease in the liver. Then we have certain nutritional deficiencies. Of course, talk about the omega-3 fatty acids. Talk about that shortly. Aging, because as we get older, our liver's ability to metabolize fat can decline, leading to fatty liver disease. As people get older, the liver undergoes functional changes that may increase the risk of fatty liver oxidative stress and lipid peroxidation. These causes can lead to fatty liver disease by disrupting normal liver function, leading to fat accumulation and inflammation in the liver. Consider. But I was just rushing somewhere that will interest a lot of women. That is polycystic ovarian syndrome, because it's involved with hormonal imbalances and metabolic syndrome, which we've just talked about. You can see that is already closely associated with what insulin resistance and fat accumulation. That is why it's very terrible. Of course, menopause. I don't really want to say what menopause cannot do. I won't say does not exist. I'll say may not exist, because menopause has a way of causing a lot of problems, a tsunami of comorbidities following menopause, which of course we know is not a disease or a natural occurrence in women, but can come with a lot of terrible complications. We have a video on menopause on Dr. Drugs, can watch on YouTube or other social media, and this is, but YouTube is better. You can see what's the relationship between high blood cholesterol and fatty liver disease. People ask ourselves, because every time you hear about fatty liver disease, you're always hearing cholesterol behind. Just as we say, behind every successful man is a woman. Just then, oftentimes behind every successful fatty liver disease is cholesterol. So you can see that high blood cholesterol or hypercholesterolemia simply means excessive detrimental accumulation of all forms of cholesterol except good cholesterol, which is the high density lipoprotein. We'll talk about the relationship between these cholesterol bio molecules, yes, shortly. And then it leads to fatty liver disease in the following way. That's what is there: hypercholesterolemia, cholesterol uptake by cells, subsequently leading towards fatty liver disease. But as a lifestyle disease, guess what? They share common risk factors. They're very good friends. But in fact, to show you how good they are as friends, fatty liver disease also is a risk factor for what? High blood cholesterol. So there you go. Now, complications. We have liver inflammation, that's steatohepatitis. Then we have that's inflammation of the liver. We have scarring, cirrhosis, liver cancer, heart disease, type 2 diabetes, kidney disease, hepatorenal complications, of course, then gallstones, because fatty liver disease can increase the risk of developing gallstones. Let's bear in mind that gallstones could be composed of cholesterol crystals. We know that cholesterol has a good part to play in production of bile. Then we have pancreatitis, which is inflammation of the pancreas, osteoporosis, insulin resistance, and a lot of other things. Because once we have high insulin resistance, we have what we call osteoclasts. These osteoclasts begin to destroy or dissolve bone away. Similarly, during menopause, the estrogen level goes down, and these osteoclasts are also stimulated to begin to dissolve bone, leading to what? Osteoporosis. That's why menopause leads to a lot of bone and joint issues. If you check a lot of women that have bone and joint issues like osteoarthritis and the rest, you find out that it often falls within that range of 45 to 55, which is also similar to the range where people have menopause oftentimes. Now, cognitive impairment, of course, because we know that may lead to hepatic encephalopathy, have liver failure, portal hypertension, ascites, as we aforementioned, and death, which is the greatest sickness. This is how we diagnose it. Medical history is very important. Then physical examination, blood test. But sometimes people are very reluctant to drop their medical history, but they don't know why. Because when you are asked your medical history or taking your parameters are taken and all that, you can give an idea of BMI, talk about other issues. Because if one is having high blood cholesterol, of course, you have an idea where the problem is and you can know where to start solving the problem from. And then we have blood tests. To talk about liver function tests shortly, triglyceride level, fasting glucose, and insulin related tests, lipid profile, of course, imaging studies, ultrasounds can give us an idea of the size of the liver, if it's above what it's supposed to be. And of course, if we're having certain kind of changes in the composition of the liver to begin to reflect mildly, but we have a better view of it when we're having magnetic resonance imaging, which of course, which is more expensive, but when necessary, your health practitioner will have no choice but to tell you that you just have to go and do that. Of course, we have liver biopsy and a lot of others. Beautiful. A lot of people keep asking, what is lipid profile? They sit on their, or they just say, go and do lipid profile. They run to the lab, they run lipid profile, and they're just looking at it, and the lipid profile is looking at them. Let me just give us an idea of what lipid profile is all about. So pay close attention, as this is also very important. Of course, most health practitioners that are here will definitely know what I'm talking about. Now, a lipid profile test is also known as a lipid panel or cholesterol test and measures the level of different types of lipids or fatty. So these parameters include total cholesterol, which has to be less than 200 milligrams per day. High density lipoprotein, cholesterol has to be equal to or greater than 60 milligrams per day. Take note of this. We'll talk about something shortly. Low density lipoprotein or bad cholesterol should be less than 100. I see some people bringing results and they write the ranges from something to 200 or something. That is completely wrong. It should be less than 100 and even less than 70 for people that are having high risk. Triglycerides should be less than 150 milligrams per DL, and VLDL cholesterol, that's very low density lipoprotein cholesterol, should be less than 30 milligrams per DL. So of importance, where we're going to, you see, these ranges have a very important role to play with regards to telling us what kind of issues may be emanating or already are happening in one system, especially lifestyle disease or cardiovascular issues and all that. Like for total cholesterol and HDL, the ratio between the total cholesterol and HDL should be below 3.4 to 1. Even if you look at these ranges you see here, you see that if you divide 200 over 60, you get 3.4. That means the total cholesterol to HDL ratio should be below 3.4 to 1. Anything above this is a strong risk factor for cardiovascular issues, including stroke, heart attack, angina pectoris, which is a symptom of myocardial infarction or heart attack, and a lot of other issues, peripheral artery disease, and all sorts of things like that. So you see how important it is that the ratio has to be looked at. Sometimes people check their total cholesterol and they may find out that it's less than 200. But they forget that if the good cholesterol, HDL, is so low, and you do the ratio of total cholesterol to HDL and it goes above 3.4, that person is still at risk. Then we have total cholesterol to triglyceride ratio has to be below 1.5 to 1. Bear in mind that having a total cholesterol to triglyceride ratio total cholesterol to triglyceride ratio should be below 1.5 to 1. Having a ratio higher than this can indicate possibility of insulin resistance and type 2 diabetes. That's just one of the things you can indicate. So you can see how important it is to know these parameters and know their relationship with each other. But for best results, we have to fast for 9 to 12 hours before this test. Yes, we've been hearing about liver function test. Liver function test is so popular that when you don't even have to explain what it is. Once just simple already, the person has gone to the lab and is doing it already without any much ado. Now, liver function test assesses the liver's ability to perform its various functions such as detoxification, metabolism, and bioproduction. This is why I'm always mentioning detoxification. It's because a lot of us do not know that when somebody takes poison, like the one that people take in Africa Magic, and the person begins to do like someone that wants to die and begins to fall down, the liver is already backing up. Because the liver is already trying to oftentimes try to detoxify it, but when it overpowers the liver, in fact, that is why you see that when people drink alcohol, the first place that gets affected when alcohol is taken in excess is where? The liver, because it tries to detoxify alcohol, which I call illegal poison in some cases. Now, parameters and what they assess in regards to liver function tests include alanine transaminase, that is ALT. When it's high, it means there's liver damage or disease. AST means there's liver damage or disease. Now, ALP means there could be bile duct obstruction or bone disorders when it is high. GGT or gamma glutamine transferase, when it's high, means liver damage, excessive alcohol consumption, bile duct obstruction as well. Now, when we have high total bilirubin, we're talking about liver dysfunction and jaundice. And of course, direct or conjugated bilirubin, when it gets high, we're talking about liver dysfunction and jaundice, of course. But when albumin is low, we're talking about malnutrition. And then prothrombin time, whether high or low, that means whether there's a problem with blood clotting. That's why sometimes when people go to the lab and they find that the prothrombin time is too high, it means they cannot even enter the theater because anything you cut there bleeds on and on and on without stopping easily. That's why these parameters are very, very important. But remember that for best results, we have to fast for 8 to 12 hours for test. Now, how do we prevent this issue? Talking about this issue for so long, you can see this woman that has been helping this liver to prevent issues, and the liver is so happy. And you can see prevention of fatty liver disease involves a combination of lifestyle modifications, dietary changes, medical intervention, and use of natural pharmaceuticals. At this point in time, I want to make a very brief announcement. Please, if I'm too fast, kindly write down your questions and we can ask at the end. You can ask questions from anywhere, not necessarily from just what we're talking about, but most preferably from what we're talking about. Now, lifestyle modifications include maintaining a healthy weight, engaging in regular physical activities. 150 minutes per week minimum is okay. Avoid sedentary behavior. I like minding my business. You don't like moving around. My brother standing Lord, you may be developing fatty liver disease. Now, managing stress as well through relaxation techniques. Getting adequate sleep is also important. Of course, dietary changes, because we know that the liver is closely linked with our digestive tract, as we know that the mesenteric blood vessels always also connect directly to the liver, through the hepatic portal vein. So anything you are eating that goes through your intestine, goes through the hepatic portal vein, enters the liver, for further processing and analysis. Now you can see that there's something called a Mediterranean diet. I hope I will be able to show us something like that shortly. I love that picture so much. I have it almost everywhere that's talking about lifestyle diseases. And we have to limit or avoid sugary drinks, refined carbohydrates, processed foods, fried foods, and high sugar food. You see people tell them, don't eat fast food, don't eat pizza, don't eat shawarma, don't eat reduce spaghetti, reduce rice, and all these things that are made in fast food restaurant, ice cream and all that. And the person tells you, then what will I eat as if we have nothing else to eat? It's because of the addiction caused by dopamine release or the pleasure hormone in the brain, because the person is already addicted to sugar. Sugar, of course, is addictive, just as cocaine is addictive, sugar is addictive. So we have to take note of that. We have to enjoy a lot of what? Fatty fish like salmon. We have berries, leafy greens, and so on and so forth. Then we have medical interventions, because you know that we need regular health checks, and we have to monitor liver enzymes. Of course, as I mentioned, we just talked about LFTs, that's liver function test. And then, of course, we have to manage underlying conditions like diabetes, hypertension, vaccination against hepatitis B and C. Then we have natural pharmaceuticals, which often give us vitamin D, omega-3 fatty acids like eicosapentaenoic acid, docosahexaenoic acid, that's EP and DHA, give us the tocopherol analogs, what we call vitamin E, ascorbic acid, of course, silymarin, which is a biomolecule that people will not know about, gotten from the milk thistle plant, and of course, also the hexacolic acid and a lot more. Now, we also have to maintain a healthy weight, eat balanced diet, exercise regularly, manage blood sugar level, lower triglyceride, limit alcohol consumption, manage stress, get enough sleep, and so on and so forth, as we have before mentioned. Beautiful. Now you can see all things bright and beautiful. Don't see Azul, don't see Lost Dry Gin, don't see Eagle Dry Gin, you don't see Jack Daniels, don't see Bailey's, Tennessee, and all that people love to drink. Do you see any St. Mauritian, or do you see Benson, or do you see what's the name of that popular one again? SK, Weed, and Cloud this or Cloud that. These are all things bright. These are people eat when they want their liver to get better. That's what I want to show. This is called the Mediterranean diet. Now we've come to management and treatment. Beautiful. Remember, it is treatable, but a lot depends on you. Now you see, lifestyle modification. We have weight loss, healthy diet, exercise, and healthy lifestyle habits. Of course, we have to avoid alcohol, smoking, and all that. Then we have medical intervention. We have medications for diabetes and high blood cholesterol, which include the statins and all that. We have antioxidants, has taken surgery in case where the liver cannot take it anymore. But bear in mind that anytime the liver packs up, know that it has had enough. It's a very powerful organ. The liver doesn't pack up easily. It's so powerful that if you divide it into three, throw two parts away, it will regenerate completely. That's how powerful the liver is. So if anybody has to need surgery, something terrible must have really happened. Then we have natural pharmaceuticals. These natural biomolecules help to prevent and treat fatty liver disease with no side effects. Of course, milk thistle extracts, vitamin C, as aforementioned. But we know that all these things will work eventually by reducing fat accumulation in the liver, improving insulin sensitivity, and all that. So that's what management and treatment is about. The health practitioner will tell you more. These are the problems. As you can see, this man does not know where to drop this rock of problems, and this is how the challenges involved in the management of fatty liver disease are. Late detection. Today, something terrible happened, and God helped us to avert it. A neighbor of ours, about 70 years, refused to check her blood pressure. I had to beg her this morning when she called to appeal that I take her to the hospital. She's taken to the hospital, and I had to come out to the BP machine. Mama, let's check her BP. She said no, she has been having BP for 13 years, and she's used to it. I appealed to her that it's wrong. She has to check her blood pressure at least before she goes to the hospital. At least since it's just a very quick check, considering the way she was feeling, and she refused that she never needed it. But by the time she came back with BP medication. That means it was already checked and confirmed that she had high blood pressure. But guess what? I was called not too long before this seminar that there was an emergency. I had to rush out to our neighbor's house and found that she was already delirious. Left hand was getting weak. She could not speak. Of course, I knew that was already a stroke. And of course, I had to start rushing her to the emergency, all because she refused to check her blood pressure. That is why she landed it. So late detection and overconfidence is a problem. I also had to talk to her pastors and other people, explaining to them that, look, even in the Bible, it said, do not put thy Lord thy God to test. If you have a problem, and even St. Luke was a disciple, was a physician. And the Bible even says that that the doctor does not come to treat those that are well, but those that are sick. So that tells you that even the Bible recognizes the presence of physicians. So I don't know why some people believe that when they talk to their men of God or something, which is good, it's good to pray. But when you talk to a man of God and you say that says you should not go to the hospital or you have overconfidence, it is wrong. God has given you doctors, pharmacists, nurses, hospitals, science, medicine, and a lot of things for you to get better, and you refuse to use them. It's a very high risk. That's just aside. This just what happened today before this seminar. Of course, thank God we got to the ER just in time. And by the grace of God, I believe that the stroke is going to reverse very quickly because treatment started again. So we have to be very conscious of this. That's just on the side. Now, self-medication, Sabinos, everybody feel they know what they're doing. Some people imagine taking Agbo that you don't know. Agbo just means all these herbal concoctions that are unstandardized. We are not against, health practitioners are not against healthy, natural medication, because it's even said that let food be thy medicine, let medicine be thy food. But you don't know the source of these things. You don't know the chemicals. It's what we call in Yoruba say baseje. That means it's coming to repair something and damage on that thing in the process. We should try to avoid all these kind of things. Self-medication does not, especially when you're not a health practitioner. Even health practitioners go and consult other health practitioners. So please, we have to stop this sapinous attitude and quickly rush the hospital and contact a trained health practitioner to assist us when we have symptoms. Poor patient compliance, because the medication may be taken for a long period of time, and some people believe that they are well because they're taking just a few of it, not knowing that the organ is just still tender and just coming out of problem, and then they abandon their medication or their remedies and just throw caution to the wind. That is also very dangerous. Now, poor health infrastructure. We all know what's happening in Africa. Of course, a lot of corruption and embezzlement and all that. See where we are, even in Nigeria right now. Make sure you don't fall sick. So I just advise anybody, because we do not have a stable health system. I can tell you that we don't have a sound health system in this country. So try not to fall sick, because sickness is not good for the poor, especially in this part of the world. Now, there's no insurance to help anybody. That's why when you go to the hospital sometimes, they have to look at your face, look at your pocket to be sure you can pay before they do anything, or they just leave the person to die. That is a problem too in some cases. I'm not saying that's everywhere, but we should take note of this. Then we have lack of trained health practitioners. Of course, that's self-explanatory. Economic challenges, poor health information and awareness system, resistance to change, old habits die hard. Imagine someone that has been a drunkard for 55 years and now come and tell the person that he must stop drinking alcohol overnight. Remember that they say a fool at 40 is what? A fool forever. That means that it's very difficult for people to change when they get to a particular age, but we just have to drop old habits so that we can move forward. Fake medication is another problem. Depression is another problem. Poverty, of course, is another problem, of course, and high cost of treatment. Chemical drug side effects. Example is the 3-hydroxy treatment, butyric enzyme A reductase inhibitors, also known for short as statins. They cause a lot of issues, especially in the muscles of the body. You have to be careful. Of course, predisposing stable food. You go to some countries or part of the world like ours here, you see that our staple food are often carbohydrates. We have cassava, we have yam, potato, we have all sorts of things. Then we have companies that produce refined carbohydrates that help us to turn this and mix and eat all sorts of heavy food that can eventually predispose us to particular disease and other lifestyle diseases. These are challenges we're having to handle. Then, now, chemical intervention, there are just a few examples of what are being used. As you can see here, but notably you see metformin, you see the statins, as aforementioned, and the simvastatin and the rest, and all that. And here, we're seeing a few of their common side effects. Now, just imagine that the statins cause muscle pain, liver damage. Imagine you're trying to solve a problem at the end of the day. So you must not deviate from the prescriptions you have been given. Don't think you know already. And then they tell you to come back for assessment before giving you another prescription, and you continue to string the statins on and on. Then later you begin to feel some muscle ache, and some weird feeling in the muscles, please do not be surprised, because this is as a result of abuse what one has been doing. Of course, you can see metformin over there. You can see that this is often used with type 2 diabetes. And of course, you just need to go and Google the side effects of metformin, and you know what I'm saying better. So please stick to your prescription and all that. And there are a lot of others there. So let's go to something natural that, of course, since lifestyle diseases often respond better to lifestyle changes and natural pharmaceuticals, whether we like it or not. That is just the truth. Because lifestyle modification and natural pharmaceuticals are what treats lifestyle diseases better. You understand? Though we need to take the prescriptions we are giving, but bear in mind that many of these prescriptions will only function as long as the half-life of the drug extends to. That is just the truth, just to take you out of danger. So if you're taking these chemical drugs, not watching the lifestyle, and you're not taking any natural pharmaceuticals and all that, one is still at risk. That is just the truth. He may never go, and the person will become what I call a customer. Now, they help resolve fatty liver disease, improve lipid profile, resolve other lifestyle diseases that are risk factors, example, type 2 diabetes, high blood cholesterol, obesity, etc. They help to regenerate and rejuvenate damaged liver tissue, prevent and resolve inflammation, destroy free radicals and reactive species that damage liver cell DNA via antioxidants, and of course, detoxify the liver and body, achieve effective weight management. Effective weight management is different from malnutrition. A lot of Africans undergo malnutrition in the name of weight loss. The liver is already suffering as a result of fatty liver disease, and then you say you want to lose weight via malnutrition. I don't know how that is possible. You must have to be able to lose weight professionally, where only the fat can be removed and the cells that are left behind are healthy. That's why you need to engage with a professional, not to start starving oneself and cause more problems. This also happens in other cases like osteoarthritis of the spine or spondylosis, where the patient is starving himself to reduce weight, forgetting that there's something that may have been written in the lab, in the MRI result, that may have said intervertebral disc desiccation. That desiccation simply means dryness. That means that area is already lacking something, and then you come and lack more things to solve the problem. It's not going to work. So one has to be very careful. You have to support gut health and digestion as well. These natural pharmaceuticals help us to achieve this. We have probiotics, we have fiber and all that. Soluble fiber, of course. They also help to tackle other liver health issues that may coexist. For instance, one may be having fatty liver disease and may also be having a liver disease in quotes, like malaria, recurrent malaria, for instance, as a result of probably poor immunity. Malaria is actually a liver disease, but people don't know, because people don't know that malaria can be rather a liver disease, because there's what we call the latent phase of the schizontocytes, or the tissue schizons. Sorry, the latent phase of the schizons, that they stay in the liver for about some time, like 2 weeks. They stay in the liver for like 2 weeks, and then after 2 weeks or so, when the anti-malaria has left the bloodstream, they come out again and turn to what are called blood schizons. And that's why people have malaria back to back, and they wonder what's going on. Talk about that some other time. So that's all. Oh, now, these products I want to talk about, I'm not saying that one must buy these exact products or use them. What we're looking at are the active ingredients and what they do. If you can get these active ingredients anywhere, please kindly enjoy yourself. But what I use for my patients are these products from Forever Living Products, because they've been around for nearly 50 years and I don't like stories. When I give my patients these things, I get amazing results. And that's why I don't joke with aloe vera gel, which has been available for like 3,000 years. What is it, 3,000 years? Maybe more than 3,000 years, from the time of the pharaohs. So we know that it's a very, very important somatic stem cell stimulant that contains a lot of things, semanan, glucomannan, contains anthraquinones, and a lot of other things that help. So these things all together come to help to heal or resolve fatty liver disease because of their immunomodulatory effects, because they also help to boost the immune system. They have anti-inflammatory effects, antioxidants, improve liver function and health, generation and regeneration of liver cells. That is super important because they have somatic stem cell stimulants. They are somatic stem. I'm not talking about what they say somebody is drinking a stem cell, pluripotent stem cell. You cannot put stem cells under your tongue. Your tongue has a barrier, and those cells cannot pass through those cells that form the barrier. Neither can they work when they have gone into the stomach, because the acid in the stomach will destroy it. So when you hear people talking about they are taking stem cells, you may say that you have powerful antioxidants. It's possible scientifically, but please do not be deceived. That is wrong. It's not correct. Then we have improved insulin function, of course, because it also helps with diabetes type 2. Anybody that knows that this also helps to resolve type 2 diabetes. Then improve gut and digestive health because of the soluble fibers in there. And of course, it helps to reduce blood cholesterol. How amazing, which is 45 and 6 of what? Fatty liver disease. This contains lecithin and a lot of other extras like thyme and garlic that have antioxidant, anti-inflammatory, lipid metabolism regulation. That just means that it has the ability to reduce blood fat and all that. Of course, anti-hypercholesterolemic. Then it also has insulin sensitizers that help your body to respond to insulin and also help to mitigate type 2 diabetes. Of course, DNA protection from free radicals because of its powerful antioxidant effect. Then we have this product that people use especially for cardiovascular issues. Is recommended oftentimes when one is having dilated cardiomyopathy or other cardiomyopathies and all that, as well as hypertension and more. But basically, with regards to what we're talking about, it helps with regeneration and rejuvenation of the heart, lungs, liver, and kidney. Bear in mind, liver. Then it also helps to counter high blood cholesterol because of its presence of coenzyme Q10 and lecithin, and it supply energy by assisting mitochondria activity. Mitochondria are just like the generator or powerhouse in the cells in our bodies. That's what it do. Now we have this very powerful antioxidants. Of course, we know we have antioxidants, but there's some antioxidants that are more powerful than other antioxidants. In short, all antioxidants are equal, but some antioxidants are more equal than others, in short. So this is one of the types we're talking about. Now, it's so powerful that it is hepato or liver cell protective, and then it prevents stressors as well from damaging the liver cells. Now, because of this antioxidant quality that it has, the DNA of the liver cells also protected, hence their function is preserved. This contains eicosapentaenoic acid and docosahexaenoic acid. We're talking about omega-3 fatty acids, and these are the chief managing director of that department. And you can see they help against inflammation, which is often associated with fatty liver disease. Then we have that they help to prevent cholesterol and fatty substance aggregation. So that means they also try to resolve other issues that are risk factors that are associated in the standard, the comorbidities of fatty liver disease as well. And then we have, of course, other lifestyle diseases. Then they also help to resolve cardiovascular complications, of course, and then resolve other associated lifestyle diseases, as aforementioned, and counter hypercholesterolemia, high blood cholesterol. We talked about soluble fibers, and they help to reduce blood cholesterol, improve gut health, and digestion, and counter hypercholesterolemia. This is a 9 days weight loss and detoxification program designed to reduce caloric intake and increase caloric expenditure systematically. I mentioned that some people reduce their weight via malnutrition, worsening the situation because as the fat is leaving the system, because remember that obesity is simply defined as excessive detrimental accumulation of body fat, period. So when you are removing the fat and you are squishing the cells, or the cells are now shriveled and malnourished, you have used one big masquerade to chase another masquerade. Fine, you have chased that masquerade, but the problem is there's a new masquerade on ground, and that masquerade on ground is cell damage and tissue damage, which can worsen the situation. So that's a no. Now, this Clean 9 also use low caloric diet plan, exercise, autophagy, which is therapeutic fasting. I told somebody one day that once you're above 40, technically breakfast is a scam. Person like, what do you mean? I'm like, yes. Because if you really want to detoxify your liver, you have to undergo 18 hours without taking food. But if you know you cannot support it, you can use things like cabbage, carrots, cucumber, and all that have next to zero glycemic index. And those can support that period when your liver is done being detoxified. You see that you begin to function better. In fact, our food may be killing us. That's just the truth. Because that's a topic I'm going to talk about soon. And of course, natural pharmaceuticals are inevitable. In this Clean 9 pack, we have what is called Garcinia Plus. This contains hydroxycitric acid. And this prevents combustion of carbohydrates to what? Fat. Then we have what is called TEM. This TEM is a thermogenic biomolecular wonder that helps to burn fat and convert it to energy. That means as you are even burning the fat, rather than the fat just disappear, it's converted to energy to help you function and hence reduce the cravings for food. It also contains aloe vera gel, as aforementioned. We know that it detoxifies the system because, of course, the liver has problem and a lot of toxins are accumulating in them. That's also important. Then it also has what we call light that contains a myriad of very highly nourishing biomolecules that help to maintain these cells in good health as their fat, the excess fat or the fatty cells are, let me put the word, surgically being removed by this technique. That's just calling that one. And that's why it's very important that we bear in mind that autophagy is super, super, super important. Guess what? The body converts what it doesn't need to what it needs during autophagy. Is that not amazing? Now, these natural pharmaceuticals that we've just mentioned are very, very safe and they do not have side effects. How amazing is that? So, this autophagy is systematically included, which is intermittent appropriate fasting and helps to detoxify the liver. But generally, this clean-9 helps against other lifestyle diseases. That's why people that have type 2 diabetes or hypertension, when they start running this clean-9 program, they begin to see that their BP begins to drop. We'll talk about that later, or you go and watch videos of type 2 diabetes, hypertension, and other lifestyle diseases on Dr. Drugs on YouTube and other places. Of course, they help to ensure weight loss without damage to liver tissue. I just explained that just now. Then they help to remove fat from the fatty liver without causing malnourishment. And they do it more. So you can just go to Dr. Drugs and watch the video on lifestyle modification, weight loss and detox, and you see a lot about the things I'm talking about right now. So at this juncture, I really appreciate everybody that has been here, and we are about to round off, but I'll leave us with this. Remember that you are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So we have to be on the winning side. Also, kindly remember what this guy here is telling us, that we should not adjust our medication and dosage without the guidance of what a trained health practitioner. This is very important. You can see he's very serious about it. You can see that. And then prevention is better than early detection. At this point in time, I will say thank you for coming and remain blessed.